International Council of Nurses report shows that COVID-19 highlighted that nurses must be the architects of future healthcare systems. It says nurses should be the designers of systems, not just the officials who plan them. For more on this, we're joined by the Council's CEO, Howard Catton, who speaks to us in Geneva, Switzerland. Mr. Catton, thank you very much for your time. Give us a much deeper meaning when you say they should be the designers of healthcare systems. These are nurses who have just observed International Nurses Day yesterday.
Good morning to you. We all know that around the world our health systems were not properly prepared for this pandemic. We have all seen how nurses have been at the forefront of responding to the pandemic, and we know that they are the key deliverers of healthcare. But what nurses also know, and what they have also seen, because they see this every day, up close and personal, they see the weaknesses, the fragilities, the inequalities, where our health systems simply don't work. And they have to work with that and work around it. Often they're putting in their own solutions, their own transformations, their own innovations. They've been doing that through COVID as well. But that voice, that expertise, that experience, so often around the world isn't included at the highest level of decision making. Many countries don't even have a chief nursing officer, but where they do have these experienced nurses, we've surveyed around the world and found that those expert nursing voices are often excluded. And that's why we're saying they are designers as well as deliverers. Make sure you've got nurses and the healthcare professionals' hands on the architect's pens of your health system design.
Yeah. You know, as I speak to you, Mr. Catton, we have a situation happening here in Johannesburg, which is where I'm talking to you from. One of the hospitals is experiencing nurses who are just outside the premises. They are standing in a long queue, having been told the previous day to come back so that they can get their vaccine doses, and then they're obviously going to have to go back to hospital and do what they do best, to treat COVID-19 patients. And the frustration, I must tell you, they're very enraged. Some of them are saying, if this is the situation, why should I expose myself and put myself in a vulnerable position? Is that the kind of situation you are talking about when you say they are at the front line, they can see it all? Perhaps they would have planned better than to see themselves standing outside waiting to be vaccinated, only for them to be told, go away and come back the next day.
I saw the pictures just before speaking to you, and I was shocked. We've heard around the world countries say, yes, we will prioritise nurses and our healthcare workers for the vaccine when it's available. But there are many countries where that simply isn't happening. We're not getting the vaccine into the arms of the most vulnerable and nurses and health workers first. I think there's a grotesque inequality around the world in terms of access to vaccines, and we have said those countries who've massively over-ordered need to do much, much more to share the vaccine. We support the patent waiver. There needs to be support from industry to help scale up manufacturing. There's a huge issue there. And you're right to point out, and I can understand not just the frustration, but I think the anger as well, for people who go to work and put themselves at risk for others, but don't then feel that their health system is really valuing and protecting them. And yes, I think it is an example, because we've seen this in other parts of the world, where you have got nurses involved in the planning of the rollout of a mass vaccination program. There's evidence it goes well. Where you've got nurses and other healthcare professionals at the front of giving out the public health messages, people accept that. They believe that. Nurses are consistently the most highly trusted profession in polls right the way around the world. Take that experience, take that expertise, take that trust, and use it to improve your health systems.
Talk to us about what your report has observed, particularly in developing countries like South Africa, the treatment of nurses since the emergence of this worldwide pandemic? How have nurses who have been in the front lines been treated, and would that then translate into their behavior towards patients? Because in South Africa, for example, you have some cases, and I'm not saying that this is the general problem, but isolated incidents, if you will, where nurses tend to not give their best to patients, and in some instances, patients dying as a result of neglect.
We have been monitoring very carefully what's been happening around the world to the global nursing workforce, and we've described something that we're calling it the COVID effect on nurses. Physical exhaustion, people who are just working back-to-back shifts and exhausted, but also these really significant mental health pressures. We've called it a mass traumatization. The failure to be able to get the vaccine adds to those pressures on health workers as well. And what we're seeing in some countries is that that is translated, understandably, into disputes and unrest, where nurses just don't feel that their rights are being protected and safeguarded. And we've also seen increased reports of nurses who are quitting and leaving the profession. Do you know that at the same time, there are some parts of the world which are seeing an increased interest in nursing. And we need that, because we need to translate that into new nurses, because we have this global nursing shortage. I think the health of the nursing workforce in many countries needs real attention, because if you are exhausted, burnt out, you don't have the protection, you don't have the equipment, you don't feel valued and respected at work. I know nurses every day want to give of their best, but they're not superhuman. They're not superhuman. They can only do that if they're properly supported.
Absolutely true. And on the back of what we are talking about, Mr. Catton, the independent panel report released on the workings of the World Health Organization, it came out yesterday calling for the overhaul of how the World Health Organization works, and in particular using the example of COVID-19, that it was simply slow off the mark to declare this early on as an emergency health issue for the world over. My question to you is, will it be acceptable, because it's not just the World Health Organization that was to blame, by the way, it was also governments who have also been slow to act on this particular pandemic. My question to you is, in a country like South Africa, where we are now facing a third wave, will it be acceptable for a lack of planning?
No, I don't believe it will be acceptable. The report that you mentioned, they included, ICN worked with the authors of that report to make sure that they were able to speak to nurses right the way around the world. In fact, their process of putting this report together, I think, is a good one, because it made sure it had those voices right from the front line. Look, I think that there's clearly areas that WHO can improve. There is a lot that they've got right in terms of, their calls for solidarity, for vaccine equity around the world. But WHO are made up of member states. They are funded by member states, and member states, countries, ultimately decide their priorities and the actions that they're going to implement. So when we point to weaknesses within WHO, don't think that that's unconnected to the countries. If we want to improve WHO, we have to do more to support them. Countries have to do more. We've heard a lot of we've heard a lot of rhetoric. We've heard applause. We see country leaders often saying the right things. And I think what we're seeing through not just nurses but healthcare workers is saying, look, the applause without action is unacceptable. You need to do the practical steps and measures, and that includes putting in place the planning. The other reason why I don't think it would be acceptable now is that there's really good experience from around the world. This isn't like at the start of the pandemic when some countries may have been unsure what to do or not. There is really good learning and experience from neighbours and from other countries that can be drawn on as well. We're not going to defeat this as individual countries. We defeat this as one world, and we need our world leaders to make sure that they come together in that spirit of solidarity as well.
Howard Catton, thank you very much for your insights there. He is the CEO of the International Nursing Council.